As provincial governments scramble to rein in rising healthcare costs, Saskatchewan is adopting an approach they say is based on the Japanese auto industry. Reforms aim to cut waste and focus on the consumer, or in this case, the patient. But can a mix of private and public services fix Canada's broken healthcare system? Let's find out. The Saskatchewan Premier Brad Wall thinks so, and he's trying to get the other provinces to see things his way. Saskatchewan Premier Brad Wall was at a major conference of politicians and healthcare leaders in Quebec today. He joins me now to give us some details. Premier, great to have you in Ottawa.
Thanks for having me on.
Innovation in healthcare. We've talked about this since the new healthcare deal that Jim Flaherty gave to the provinces. Anytime you talk about innovation in healthcare, there's always real concerns about private versus public. What kind of innovations were you talking about today?
Well, certainly the mix between public and private is very much in debate right across the country, and different provinces take a different approach. I'll give you a Saskatchewan example. We have a surgical wait times initiative. We have a guarantee that we're working to keep to the people of the province, and that is this, that you will get your surgery within 3 months in the province of Saskatchewan. We've given ourselves 4 years to achieve the goal, and we're making progress. People waiting longer than 18 months, down 92%. People waiting longer than a year, down almost 80%. Progress on every front. Now, we are, in addition to utilizing the public system to a fuller extent, we're allowing private clinics to come in and deliver public surgeries. In other words, no one's jumping the queue, no one's slapping down a credit card to get ahead of the line. But to add capacity, we have a private clinics operating in the province. But it's demonstrating results. And if you talk to Saskatchewan people, give them a choice between sort of timeless ideology or timely surgery, as long as it's the public system, they're picking the latter.
This is fascinating because every province talks about capacity, and they use that kind of vocabulary. It's happening in the Alberta election right now. You hear,
right.
Danielle Smith talking about this, and Alison Redford. Right across the country, at what point does the line converge, and what's the model there? You have CMA, Medical Association, and other groups have said, look, there's only over 90 clinics across the country that are essentially private that violate the Canada Health Act, which is the duty to provide equal access on that element of the and that no one's enforcing the Canada Health Act. So I guess my question is, when does the Canada Health Act essentially become a guideline as opposed to something to enforce? Because frankly, the line is so blurred now.
I mentioned that this morning at the forum. There seems to be a different interpretation depending on where you are in the country and which province you're in. And here's where the federal government perhaps needs to take a more active position. They've said pretty clearly that they're going to get out of the business of increasing transfers at the rate they've been increasing them, and they're not necessarily interested in a broad innovation fund. And so now the
which
premier,
you put forward and they rejected.
True, and so now the premiers are dealing with that and working on our own to find those innovations together to compare best practices. But on the issue of the Canada Health Act, that is very much federal. That is the federal area in healthcare. There's no question about it. No dispute there. And in the meantime, each province is interpreting it in a different way.
But this is interesting because innovation, on one side, it can be used as kind of synonymous with efficiency, getting wait times down, finding out where the slack in the system. You've talked about that. Some interpret it as code word for getting rid, for sort of the two-tier in those old terms. I only ask you because the Canada Health Act, when the government started, they used to spend 50% of the dollars for healthcare to the provinces was from the feds. Now it's under 25%. Do they still have a mandate to enforce the Canada Health Act to the provinces when they're not transferring the same amount of money?
I think Canadians expect that there would be some national regime, some rigor nationally, some legislation, the Canada Health Act, that they would want them to be responsible for. I think that's completely, I think that's in line with what Canadians would want. But I just want to say this, that innovation, of course, does not just mean maybe alternative delivery methods in the provinces. It can also mean applying lean management techniques to healthcare. We're doing that in the province and seeing some great results. And
just explain what that is. Sure, it's an interesting program.
Sure. Well, it's really the model pioneered by Toyota as a manufacturer, and it's been applied to other manufacturing sectors and other organizations, and we're applying it to healthcare. And I just want to say this, Evan, we have a lot of work to do in the province. Our emergency rooms are still too crowded. Our wait lists are still too long. So all of the examples I'm going to point to are just indicators that we need to do more. But lean, for example, means that when we manage our blood inventory, when we manage the discarding of red blood cell units, we do so in a way that is consistent with lean and save $10 million. Lean management techniques have meant that we've reduced the wait time for people between the first visit to the cancer agency in Saskatoon in their first CT scan by 92%. Lean techniques, it means that we've reduced the the size of the new children's hospital in Saskatoon by 16%, saving millions. It listens to the front line. It listens to patients who will come up with common sense ideas like, why are you walking down 3 corridors to get warming blankets for chemo patients when they could be at the station? That's an oversimplification.
Right,
but that's kind of what lean is, and it can have big results or incremental results, but that's part of innovation too.
And 99% of surgeries in your province are done within 18 months, and that's had a big impact. But the rubber hits the road politically. Again, I'll just go back to it. You know, people don't understand how we're trying to have a national conversation about healthcare, about innovation. You're talking about this innovation fund, and the provinces are all doing different things. When people look at, here you are in Ottawa, you and I could drive across the river to Quebec and get an MRI for $500 bucks. Can't do it here.
You can do the same thing in Alberta.
Right. So you can do that. You can get CT scans. You can pay for them. Some critics say that's the private healthcare system. There's 90 or more clinics that are doing it. They are sucking out nurses and doctors away from the hospitals. It clearly is a two-tier system. Is that innovation, or should that stuff be shut down in your mind?
Well, I mean, I think if you talk to people in Alberta and Quebec, they're happy with that particular system. They have the option of waiting through the public system or going ahead and purchasing those diagnostics. In our province, we haven't made that decision. That's not the cue we've certainly gotten from the people in Saskatchewan, and we wonder if the additional capacity is really the issue on diagnostics for our situation. Having said that, this system is not set to serve any ideological politicians. This healthcare system is about patients, and it's about the people. And one of the beauties of the system, even though it's going to be disparate in this confederation and unique to each province, one of the advantages of it is that each province will be sensitive to the demands of their patients and citizens.
But then there's no federal standard then. I mean, then it's fine. But then should we just discard the old? I mean, is it a myth then just talk about, one healthcare system when now we're talking about Alberta may have one and Saskatchewan may have one and Quebec will have one. They each justify different capacities, and there's no longer a national healthcare system.
I think the national standards, the Act itself, are still very much valid, still very much relevant today. And even though you've pointed to a couple of examples in Quebec or Alberta, and there will be others that the CMA could point out, fundamentally though, across the country, we've got a public system. It's universally accessible. It needs to be improved. It's not as timely as it should be in many cases. But that's a value that Canadians still prize.
But what about in 5 years? I mean, if under the guise of innovation and provinces wanting to go their own way for maybe reasons, long wait times, whatever, in 5 years, will you and I be sitting down here and you'll say, well, there's not just 90 clinics now that you can get, there's 400 clinics. Because there's money to be made, and that may exacerbate problems in the public health system or in various places. So I guess what I'm trying to figure out is where's the trajectory going here?
Well, I don't think anyone can accurately predict that. I really don't. I think provinces are working hard to respond to needs in their own jurisdictions. We're also working together. Premier Giz and I are chairing this group of health ministers. We'll report back to the premiers this summer on scope of practice, on clinical guidelines that we can do nationally, on healthcare human resource cooperation. But the bottom line is, I think Canadians value a system where it doesn't matter how much is in your wallet, you can expect quality health care. We need to improve the efficacy of the healthcare system, but I think that's a pretty important fundamental principle. It doesn't answer all the questions you've asked, but it might answer the most important one. And within that question, there is still a lot of room for improvement in terms of that public system, and that's what we want to talk about.
Let me tack just one other issue while I've got you. The Natural Resources Minister was on the program yesterday, Joe Oliver, announcing the kind of one review, one program system. This is the speeding up, streamlining, pick your adjective depending on what side of the political equation. Is it fast tracking? Is it streamlining the environmental assessment process when it comes to big energy projects? Supporters of it say it's really helpful because it gets rid of a kind of a bogged down system. Critics, including, by the way, the Saskatchewan Environmental Society, says it's really stripping away environmental protections, and we don't have all the details, but things like the Fisheries Act, and it's really putting the environment, throwing it under the bus for big energy projects. Where do you stand on this?
Well, we support the change. We support the federal government's making this move. We want to have rigorous environmental tests applied to these projects, to natural resource development in our province and across the country as Canadians. But there doesn't need to be two processes. And I guess that's been our point. It's been the point of the Western Premiers. It's been our point in Saskatchewan. We have a rigorous environmental code. It's unique in the country in that it's more prescriptive. We've moved to, I think, a very results-based system that is sensitive to water quality. We have a watershed authority in our province. We have the Ministry of the Environment engaged on that front. And we will make sure that assessments are rigorous and that projects meet standards, high standards, before they go ahead. But we don't think there needs to be, two processes.
But I mean, I just go back to the potash, where you wanted the federal government to protect not the technical way, but a strategic resource, potash. So there's federal standards to protect that. Shouldn't there be federal standards, or should there be federal standards in terms of environmental protection? Because what happens in Saskatchewan doesn't stay in Saskatchewan. When you're developing oil sands in Alberta or Saskatchewan, the results do not respect provincial boundaries. Should there be a national enforcement as opposed to a provincial one?
But there weren't two different processes on the potash deal. There was one. It was the federal government's net benefit test.
Right.
We were engaged. We gave our opinion, but it could have been ignored, and we're grateful it wasn't. So I think we're looking at something similar in the environment. There's many examples that we could point to of even on the fishery side where things have gotten a little bit out of the realm of common sense. One particular project, one mining company, well established, a good corporate citizen, was told to build a bridge over a stream bed that had been dry for years, as long as people could remember. They designed it. DFO said, actually have to make it higher so that boats can pass under it, missing the point entirely that the stream bed was dry. And so,
but is that throwing out the baby with the well? It held the river water.
The problem is it's more than just anecdotal. There seems to be a number of delays, whether it's pipelines or mining projects. People in the province, we in our province and right across the country, we value our habitat, we value our water quality. They're going to hold the provincial governments accountable to rigorous environmental standards. We can do that and balance that against also being an attractive place for investment in natural resources without duplicative processes.
But I'll tell you, you saw those 600 plus scientists writing to Stephen Harper saying, don't gut the habitat section of the Fisheries Act, because who speaks for that? It's dangerous. So, it's tough to figure out for the public if there's fair balance here.
We're very conservation minded when it comes to our very robust fishery that we have, our freshwater fish. It's generally about sports fishing, but we have a bit of a fishery, and provinces take these things very seriously. Each has an environmental ministry, and I think that's the point we made.
Premier of Saskatchewan, Brad Wall. See, when I get you in Ottawa, we get these long conversations. Good to have you here.
Thanks, Evan.